Hello, and a very warm welcome to UMCC Medical Consultant Connectors. I'm so glad you've joined us today. Here, we believe that knowledge is a powerful tool for your health journey. Our goal is to break down complex medical topics into clear, understandable information that empowers you. Today, we're going to discuss a serious but rare condition called cystic fibroids. It might sound intimidating, but talking about it openly lets us demystify it. Your health truly matters. Being informed is the first step toward advocating for yourself. Navigating health can feel overwhelming when terms are unfamiliar or frightening. That's why we're here, your trusted source for clarity and support. Fibroids are common and affect many women, but if an infection occurs, the situation changes dramatically. Understanding cystic fibroids is vital because early recognition and treatment are key. We aim to be informative, supportive, and reassuring. This info is meant to educate and guide, not replace your conversation with your healthcare provider. Every person's health story is unique. Your doctor is your primary partner. UMCC's mission is to supplement that relationship and boost your confidence to ask the right questions. We're in this together. A few minutes of learning can make a big difference. Let's begin. This 5-minute guide will walk you through the essentials. We will cover what cystic fibroids are, who is at risk, what causes them, symptoms to watch for, how doctors diagnose the condition, treatment options, and tips for maintaining your health with fibroids. So let's start with the basics. What exactly are cystic fibroids? First, it's important to understand what a fibroid is. A fibroid is a non-cancerous growth that develops in or on the uterus. They are incredibly common, and most of the time they don't cause any problems. However, in very rare instances, a fibroid can become infected with bacteria. When this infection occurs, the fibroid is then called a cystic fibroid. Think of it like any other part of your body getting an infection. In this case, the site of the infection is a uterine fibroid. This complication is serious because the infection can potentially spread. This condition is quite rare, so it's not something every person with fibroids needs to worry about constantly. However, it's good to be aware of the risk factors. Cystic fibroids are most often seen after a medical procedure involving the uterus. Childbirth, a miscarriage, an abortion, uterine artery embolization, treatment for fibroids. The reason is that these events can sometimes introduce bacteria into the uterus, and if a fibroid has a poor blood supply, it can become a prime location for that bacteria to grow and cause an infection. It is essential to understand that having fibroids does not mean you will get a cystic fibroid. The vast majority of people with fibroids will never experience this complication. The condition arises from a specific sequence of events, usually involving a recent uterine procedure. People with a weakened immune system may also be at a slightly higher risk. Now let's talk about something incredibly important: the symptoms. How would you know if you might have a cystic fibroid? The signs are often quite distinct and should prompt you to seek medical attention right away. The most common symptoms are similar to those of a serious infection anywhere else in the body. You might experience a high fever, which is your body's natural response to fighting off an infection. Chills. This is often accompanied by significant pain in your lower abdomen and pelvic area. This pain is typically more severe and persistent than normal menstrual cramps or fibroid-related discomfort. In addition to fever and pain, you may notice other concerning signs. A foul-smelling or unusual vaginal discharge is a major red flag, as it can indicate an infection within the uterus. You might also feel generally unwell, malaise, fatigue, weakness, a lack of energy. Some people also experience a rapid heart rate. It's crucial to listen to your body. If you have recently had a baby, a miscarriage, or a uterine procedure, and you start developing these symptoms, it is not something to wait out. It's time to call your doctor or go to the emergency room. It's easy to dismiss some of these symptoms. You might think the pain is just a part of recovery. However, the combination of these symptoms, especially fever, severe pelvic pain, and unusual discharge, paints a very specific picture. Do not try to diagnose yourself or assume it will go away on its own. When it comes to infection, time is of the essence. Trust your instincts. If you feel that something is seriously wrong, you are almost certainly right to seek help. Remember, you are your own best advocate. No one knows your body better than you do. Never hesitate to make that call. So what happens when you go to the doctor with these symptoms? How do they determine if you have a cystic fibroid? The diagnostic process is a careful investigation. Your doctor will ask about your symptoms and recent medical history, paying close attention to recent pregnancies or uterine procedures. Next, a physical exam, including a pelvic exam. The doctor will check for uterine tenderness and assess any vaginal discharge. Your doctor will order tests to get a clearer picture. Blood tests to look for infection like a high white blood cell count. They may take samples of blood, urine, or tissue from the uterus. All samples go to the lab for culture to identify the bacteria. Imaging is another key step. An ultrasound, Connecticut scan, or MRI of the pelvis help the doctor see fibroids and look for signs of infection, like gas bubbles or a collection of pus, an abscess. Once septic fibroid is confirmed, treatment must start immediately. This is not a wait-and-see condition. Primary treatment: strong intravenous antibiotics. You'll likely be admitted so you can be monitored closely and receive antibiotics directly into your bloodstream. The goal is to control the infection quickly and prevent sepsis. If antibiotics aren't enough, for example, an abscess or dead fibroid tissue, a procedure may be needed. That might be draining the abscess, or surgery to remove the infected fibroid, a myomectomy. In life-threatening widespread infection, removal of the uterus, a hysterectomy. Urgency cannot be overstated. Swift, aggressive treatment is essential. For those of you living with fibroids, you might be wondering what you can do to stay healthy and reduce your risk of complications. While you can't entirely prevent a rare complication like a septic fibroid, you can take proactive steps to manage your overall health. Following your doctor's instructions for care after any uterine procedure is paramount. This includes proper hygiene, taking prescribed medications, and attending all follow-up appointments. Maintaining a healthy lifestyle can also support your body's ability to heal. This includes eating a balanced diet with fruits, vegetables, and whole grains, which can help manage inflammation. Regular, gentle exercise can improve circulation, which is important for tissue health. Managing stress through practices like mindfulness, yoga, and meditation can also support your immune system. It's also important to have an ongoing dialogue with your healthcare provider about your fibroids. Discuss your symptoms, treatment options, and any concerns you may have. If you are planning a pregnancy or procedure, talk about the specific risks and what you can do to prepare your body. Remember, knowledge and communication are your strongest allies. You are not alone, and your medical team is there to support you. Thank you for spending this time with us at UMCC Medical Consultant Connectors. We hope this guide has been helpful and provided you with clarity. Your health is your greatest asset, and taking the time to understand it is an act of self-care. If you found this information valuable, please like this video, share it with others who might benefit, and subscribe to our channel for more 5-minute guides. We are committed to empowering you with knowledge because at UMCC, your health matters most. Stay safe, stay informed, and be well.